This is Dr. Anesh Rugnath, and my topic is low back pain and leg pain, which I've divided into 4 sessions. The first session is epidemiology and history of low back pain. So the session objectives for today is to discuss the epidemiology of low back pain, detail the burden of low back pain on society and the economic impact on healthcare, to discuss the current trends of low back pain, and to look at those patients who have risk factors to develop low back pain. Starting off, we will talk about the International Association for the Study of Pain, what their definition of pain is. So pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in terms of such damage. The important concepts to remember here is that it's both sensory and emotional. It's not sensory or emotional, so both those components have to be present in pain. Looking at actual or potential tissue damage, you don't have to really see something visually wrong with the patient to believe that the patient is in pain, which shows the subjectivity of pain. Going on to the epidemiology, more than 80% of adults will experience back pain at some point in their lifetime. More than 85% of patients who present to their primary care practitioner with low back pain, and after being examined and investigated, the vast majority of these you can find no attributable cause. There's no specific disease or spinal pathology that points to why they're having back pain, so we term this as non-specific low back pain. Almost 90% of the source of low back pain is mechanical, and we'll discuss later on what mechanical low back pain is. And the good news here is the prognosis in these patients are generally very good. Low back pain can be classified into 3 categories: acute, subacute, and chronic, with acute lasting less than 6 weeks. 50% of these patients get better within the week, with 90% of them having pain resolved within 6 to 8 weeks. If it goes on more than 6 to 8 weeks but less than 3 months, we term that as subacute low back pain. Pain persisting more than 3 months, which happens in about less than 5% of acute low back pain patients, we go on to call these patients chronic low back pain patients. Prevalence of low back pain increases with age, and generally peaks around 55 to 64 years of age, but generally affects all ages. Men, women, and all ethnicities are equally affected. Patients with low back pain, generally 50% of these patients have a recurrence within the year, or 70% will have a recurrence in at least 5 years. This graphic shows that almost 33% of patients between the ages of 33% of patients present to low back pain. Most of them are in the age group of 45 to 64 years of age, and generally as you get older the incidence doesn't really increase but kind of stays the same. Where do these patients with low back pain seek care? 77% of them have outpatient treatment, seeking care from their primary care physician or other physicians in the outpatient setting. Almost 19% will go to the hospital, with outpatient centers in the hospital or the emergency room. Only about 4% seek inpatient care for low back pain. What is the burden of low back pain on society and the country as a whole? It is the most common cause of work-related disability in the United States. It's the 5th leading cause of medical office visits in the United States. It is the 2nd most common cause for symptom-related physician visits. 5% of yearly PCP visits are for low back pain. The good news is that 82% of these patients generally get better within 3 months and return back to the workforce, but 2 to 5% of these patients go on to claim disability for their low back pain. Again, The peak time we see this is between 55 and 64 years of age, but all ages are affected. What are the healthcare impact of low back pain? 52 million healthcare visits annually are for low back pain, as seen in 2010. There has been a 66% increase in patients seeking care for low back pain between 2000 and 2010. 9% of all hospital and emergency department visits are for seeking care for low back pain. 15 million hospital days, that's 8% of all causes of pain, are for low back pain. And in 2011, we see that there were 742,000 spine procedures performed to treat patients with low back pain. So it is the most common cause for activity limitations in patients under the age of 45, and this is important because it affects the general health and activity of these patients, affecting both their mental and physical health. 2% of Americans workers suffer compensable back injuries each year, which is a staggering 500,000 cases per year. Low back pain accounts for almost 19% of all workers' compensation claims in the United States yearly. This is more disability claimed than cancer, heart disease, stroke, and AIDS put together. In 2013, we spent almost $90 billion treating back and neck pain, which was an increase of $64 billion from 1996. What is the economic impact of low back pain when it comes to lost work time and wages? Hospital costs to treat low back pain in 2011 amounted to about $150 billion. In 2012, we had lost work days amounting to around $291 million, and we see there's an annual earning loss to persons in 2011 of almost $131 billion. So it has a great economic impact on the country and society. This slide shows you shows all patients presenting with some sort of pain at any given point, and you see one of the leading causes with almost 2.1 million cases is attributed to low back pain. Let's talk about the current trends of low back pain. There's definitely an increased utilization of image studies to diagnose low back pain, increased incidence of surgery to treat low back pain, increased utilization of injections and other invasive modalities to treat low back pain as an outpatient. There's an increased prescribing of pain medication, especially opioids, to treat low back pain that has led to the current opioid epidemic that we are seeing, and opioid use disorders in patients. So all this has created a tremendous increase in costs for treating low back pain, but overall there has been no decrease in disability caused by lower back pain. Who are people that we have noticed that who are at increased risk for developing low back pain? Those who are born with congenital spine abnormalities like spina bifida. Smoking is a big contributor to low back pain, especially in the age above 50. Smoking has got many toxic chemicals that is directly toxic to nerves. Also, smoking increases the drying up and desiccation of intervertebral discs, which increases the incidence of low back pain. Occupation plays a big part in development of low back pain. Those who are engaged in very physical physical requirements in their occupation, or who do menial tasks, have definitely an increase in incidence of low back pain. Those who have had episodes of low back pain in the past, they are prone to develop low back pain in the future. Being physically unfit causes a loss of core strength. This increases stress on the spine itself because the muscles are not strong enough to support that spine, leading to increased low back pain. Obesity places extra pressure on the spine itself, again leading to increased low back pain. As we get old, we have a lot of degeneration and arthritic conditions that increase our risk factor for developing low back pain. Education plays a big part but especially with people not being educated enough to engage in activities that will protect their back. Generally, with lower education leads to occupations that require greater physical activity, again leading to increased risk of low back pain. There are a lot of hereditary conditions like arthritic conditions that predispose to the development of low back pain. Patients with mental health disturbances, especially with stress, anxiety, and depression, generally present with higher degrees of low back pain because stress, anxiety, and depression generally causes them to catastrophize about pain, increasing the pain perception. When a patient is in pain, generally they have more stress, anxiety, and depression. Those wishing to read more about
Anesh Rugnath of
the epidemiology and natural history of low back pain, here are some of the references.
divided into four
Our next topic
sessions. The first session is epidemiology
for back
and
pain
history
will be the
of
anatomy
low
and
back pain.
pathophysiology of low
The
back
session
pain.
objectives are
Thank
to
you.
describe the epidemiology of low back pain, discuss the burden that low back pain has placed on society and its economic impact on healthcare. We will also talk about the current trends of low back pain and look at those who are at risk for developing low back pain. We will start off with the International Association for the Study of Pain and look at their definition of pain. Pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in terms of such damage. The important parts to pay attention to here is that it's both sensory and emotional. It's not sensory or emotional, so both those components have to be present to describe it as pain. It's also actual or potential tissue damage, so it doesn't have to be something that you can physically see to describe it as pain, and this also leads to the subjectivity of pain being described by the patient. So let's get into the epidemiology of low back pain. More than 80% of adults will experience some sort of lower back pain in their lifetime. 85% of patients present to their primary care with low back pain. After investigations and examination, we cannot attribute the pain to any specific disease or spinal pathology, and therefore this larger group is generally put in the category of non-specific low back pain. Majority of low back pain, up to 90%, is generally mechanical low back pain, which we will describe later on what mechanical low back pain is, and generally they have a good prognosis. Low back pain is normally classified into acute, subacute, and chronic, with the acute normally lasting less than 6 weeks. 50% of these patients get better in about a week, but the vast majority, up to 90%, definitely get better within 6 to 8 weeks. If it lasts longer than 6 weeks but less than 3 months, we generally describe that as subacute lower back pain. Chronic back pain is the back pain that persists more than 3 months. This makes up generally less than 5% of patients who present with acute back pain. Continuing the epidemiology of low back pain, the prevalence of low back pain increases with age. It generally peaks around the age of 55 to 64 years of age, but affects all ages from the young to the old. Men, women, and all ethnicities are equally affected by low back pain. Patients who've had episodes of low back pain generally have recurrence within the year in about 50% of those patients. 70% of patients with previous episodes of low back pain experience a recurrence in about 5 years. So this is just a graphic showing you as you get older, the incidence of low back pain in the general population. You can see between the 45 and 64 year age group, you get almost 33% of patients who present with low back pain. Of course, it doesn't decrease much as you get older, but that's about when it peaks, around the age of 55 to 64. Where do these back and neck pain patients seek medical help? 77% of these patients go to their primary care or other outpatient physicians initially. 19% will visit the hospital emergency department or even facilities as an outpatient in a hospital setting. You see just 4% get admitted and are treated as an inpatient for low back pain. So what is the importance of low back pain to society and healthcare and the economic impacts that it places on the United States? Low back pain is the most common cause of work-related disability. It is the 5th leading cause of medical officer visits to the United States. It is the 2nd most common cause of symptom-related physician visits. 5% of all PCP visits in the year are related to patients seeking care for low back pain. The good news is more than 80% of these patients return to work within 3 months, but a percentage between 2 to 5% will eventually go on to seek disability for their backache. Again, you see a peak incidence between 55 and 64 years of age, and this affects almost all ages. Occupation, obviously you can see the more menial and labor intensive tasks that you engage in, the more wear and tear and the more disability you get from spinal conditions. What is the healthcare impact of low back pain? 52 million healthcare visits in 2010 was attributed to low back pain, and it's getting progressively worse, where we see between 2000 and 2010 there was a 66% in physician visits for back and neck pain. 9% of all hospital and emergency department visits were attributed to a diagnosis of back and neck pain. There's about 15 million hospital days where patients were admitted in the hospital in 2011 for low back pain, compared to 8% for all other causes, which was 8% of all hospital days compared to other causes. 742,000 spine procedures were performed in 2011 for back pain. It is the most common cause of activity limitations in persons under the age of 45 years of age, taking a big toll and making a big impact in the daily lives of people. 2% of American workers suffer compensable back injuries every year, which amounts to about 500,000 cases per year. 19% of all workers' compensation claims in the United States is due to backache. Backache leads to more disability than cancer, heart disease, stroke, and AIDS put together. In 2013, almost $90 billion was spent on treating back and neck pain, which was an increase greater than $64 billion from the year 1996. Looking at the
Economic impact of low back pain, mainly due to lost work time and wages. We see in 2011, 150 billion was spent to treat low back pain. 291 million were due to lost work days, and 131 billion was the annual earning loss for persons with back and neck pain. Just a chart to show you all patients presenting with pain, the contribution of low back pain to this list. You can see almost 2.1 million patients with pain are in the low back pain category, where if you exclude low back pain from the total pain patients of in excess of 3.5 million, you get 1.6 million of other causes. So low back pain is a big factor contributing to pain in the general population. The social impact of low back pain is 82% of patients with low back pain states that the lower back pain does impact their daily life. Now, this is important for the social well-being of patients. This interferes with the ability of the patients to partake in their activities of daily living, like bathing and cooking and feeding themselves, where they need help to accomplish this. Also, this plays a big part in the mental health of the patient, where they exhibit avoidance behaviors and do not go out and partake in recreational activities like hunting and fishing or family gatherings, and leads to stress and depression. Looking at the current trends of low back pain over the years, we can see there's definitely been an increased utilization of studies being done. There's definitely an increased incidence of surgery being performed. When it comes to pain management, increased use of injections and other invasive modalities to treat back pain. Definitely an increase in medication use, especially the prescription of opioids for the treatment of low back pain, that has currently led us to this opioid crisis, where we have tremendous abuse of opioid and opioid use disorder in a lot of patients. So all this has increased the cost of treating low back pain. But in spite of that, we have seen no decrease in overall disability caused by low back pain. Which patients are at increased risk for low back pain? We'll see those who are born with congenital spinal abnormalities like spina bifida, etc., generally going on to have low back pain. People who smoke have a higher incidence of low back pain, especially in their 50s. Smoking has got a lot of toxic chemicals that leads to direct nerve irritation and nerve damage. Smoking also leads to drying up of certain structures in the body, especially the intervertebral disc, and this leads to back pain. Occupation plays a big role in low back pain. Of course, if you are involved in an occupation that requires a lot of physical activity, you increase the wear and tear on the spine, increase the degeneration, and that leads to increased backache. People who've had a prior episode of backache, they generally tend to go on to have repeated episodes of low back pain. When you're physically unfit, your core strength is weak. This leads to less support of the spine itself, leading to increased stresses on the spine and increasing degeneration. Again, obesity places a lot of extra weight on the spine, increasing the rate of degeneration. As we get older, definitely we have increased degeneration of the spinal structures, leading to more risk of developing backache. Education plays a big role in patients developing backache due to not having the knowledge on how to protect your back. Again, education generally leads to occupations that require more menial tasks and physical activity, again leading to
increased backache. There are a few hereditary conditions that can predispose you to backache, especially if you develop early onset arthritis, etc. Mental health disturbances contribute to the patient's perception of low back pain. Generally, those with stress and anxiety and depression are more prone to develop low back conditions, and it's a vicious cycle. The pain leads to more stress, anxiety, and depression. The stress, anxiety, and depression obviously tends to make the patient catastrophize about pain, increases their pain perception. Here are some references if you wish to delve more into the epidemiology and natural history of low back pain. Our next session we will discuss the anatomy and pathophysiology of low back pain. Thank you.